Good afternoon. I'm Dr. Howard Haft. I'm an executive director with the Maryland Department of Health, and I'm here today to talk about outbreaks with the coronavirus. As I'm sure you're well aware, we're experiencing an unprecedented pandemic across the globe and across the nation and here in Maryland. And particularly vulnerable are those individuals who are in congregate facilities. In any kind of congregate facilities is a place where this virus can unfortunately spread. And we also know from experience from here and from other places that individuals who are in congregate facilities who are elderly or have chronic diseases are extraordinarily vulnerable to this virus. We've seen more than 200 outbreaks across the state in the last month or more, and the majority of those occur in skilled nursing facilities. But we've learned a lot. We've learned from other places, and we've learned from experience here in the state. And what we know now is that in order to combat this epidemic, that we need to do many things that have already been done in terms of social distancing and all the mitigation factors that have effectively tamped down what could have been a horrendous outbreak within the state. But we also know within skilled nursing facilities there are things that must be done and are being done across the state in an aggressive way. Among those things are to early on to identify anyone who might be someone subject to or having COVID-19. And once identified, to aggressively intervene within those facilities. This is a massive undertaking for these facilities. It includes having to cohort patients who have been tested positive from those who have been tested negative, to cohort the staff who care for those, to increase tremendously the amount of attention that's done across the board in terms of hygiene and other factors. And it's also necessary to monitor those patients very closely, to monitor staff as they come and go, and to cooperate with all of the facilities and all of the folks who do this work across the region and across the counties in which these occur. This is happening right here in our county, and I can assure you that the state and the facilities are doing all the things that are necessary to make these as least impactful as possible. There will be people who get coronavirus in skilled nursing facilities. That's unavoidable. Even with the greatest precautions and even with the most intense supervision, it's a disease that spreads so easily and so rapidly. But importantly, we can do things to mitigate that impact. And I believe that that's what's happening here and now in this county. I'm going to make it my business every day to check in here in the county to make sure that every one of the facilities is doing absolutely the best that they can, and I'm confident that they will do that. And I'll be available for questions. Thank you.
Good afternoon. My name is Joyce Riggs. I am the spokesperson for Sage Point Senior Living Services. Since the beginning of the COVID pandemic, Sage Point has recognized the need to have full, frequent, and transparent communication in accordance with all the HIPAA guidelines with residents, family members, community partners, and all of those that we needed to communicate with. The first patient to test positive was March 30th at Sage Point. Immediately, we took the following actions to make sure that we did what was best for our patients. We fought hard to make sure that we implemented a plan to test all patients. We felt that that was the most important thing to do so that we could do, as Dr. Haft said, the steps we needed to do to mitigate the spread. We implemented the plan to cohort patients into positive and non-positive areas to reduce the spread. And we dedicated staff to be able to take care of those people in those areas. We worked tirelessly with all county, state, and local officials to make sure that we were following all of the guidelines and implementing all of the necessary procedures. And in fact, our health officer, Dr. Lowry, we quoted in one of our statements as saying that we came out with those plans well before they needed to be implemented or before they were mandated. So we were ahead of the curve in trying to make sure that we did what was best for our patients. We continued to communicate via our webpage, which we set up designated to speak about the COVID updates for our families. And then we continued communication directly with the point of contact with every family member that was the designated point of contact. Recently, we upped the communication to have 2 designated nurses that were calling every patient every day, not just the positive patients, but every patient in the facility, to give them an update on what we did. Right now, the communication has been, obviously HIPAA laws require us to communicate with that designated point of contact, but we think we've gone above and beyond to try to communicate with the family members. Thank you very much. So our requirement is to report that information up to the Maryland Department of Health. The Maryland Department of Health decides when that information gets released. I don't know, Dr. Haft, did you want to speak to that anymore, or are we good? Okay. Okay.
So thank you. I think that's of course of interest to everyone. It's particular interest for the family members who those patients who are in those skilled nursing facilities. And I'm comfortable with the fact that the facilities are communicating to those who need to get that information on a regular basis. From our perspective, from the state, we're going to be aggregating so that the information across the county and across the state and report it in a responsible way. Right now, we don't have a responsible way to report that compares kind of apples to apples across facilities, and because until we can get that, and I'm sure that'll be very soon, we'll be happy to report that on a regular basis. I don't have visibility on that at this time. So our first responders treat every facility the same, and they treat it with a high degree of respect for this coronavirus, and make all the necessary precautions. So I think they're well aware. It is a facility, yes. Again, I don't have visibility on that. It's my understanding that they're communicating on a daily basis with family members or points of contact. Again, their families are, each family is unique, and there are frequently more than one family member, so I can't opine to whether all family members or only the point of contacts are communicated with.
And these facilities have made news all across the country. They're dealing with,
Yes.
as you mentioned. What we've heard from some family members is that this Sage Point is the best in the county. They love it, but that they're understaffed and overwhelmed. Is that the status?
So I would say that, to my understanding, again, that they excuse me, at or above the staffing requirements, so that from the perspective of the state, they're not understaffed. In terms of overwhelmed, I think we're all overwhelmed by this, and I don't think any one of us can say this is not an overwhelming situation. So that would be a universal statement at this point.
And what about at Sage Point? We heard from an employee who said that she had been sick and home quarantined and was encouraged to come back ASAP. Is that protocol?
So I can't give you an opinion on any case that I don't have any visibility on or any knowledge of. But it's my understanding and my belief that that the usual periods of quarantine after turning positive is what's been adhered to strictly here also. Yes. Thank you.
Reuben Collins, representing Charles County Board of Commissioners and Charles County. As a community and as a government, we understand the unique challenges that COVID-19 places on our community, especially our nursing homes and senior living facilities. Our hearts go out to the individuals and families who've been affected by this deadly disease. Here in Charles County, we truly respond as one community. We take it very seriously, that we all work together, and we will continue to fight this COVID-19 emergency together as a community. We commend Sage Point Senior Living Facility for taking very proactive measures to ensure the safety of their residents and for being a good community partner in the fight against COVID-19 in Charles County. Again, we will also continue to support the efforts of our local health department and Sage Point to ensure the safety and well-being of our most vulnerable population, and we will remain in compliance with state mandates regarding prevention and care. Thank you very much.
Mr. Collins, are you pretty confident that the information that the community at large needs to know is getting out?
I would say absolutely. So one thing that we've done as a local government is taken the responsibility of providing distinct information and gathering that information on a regular basis to provide to our public. We've made that an absolute priority, and we will continue to do so.
Do you feel like the folks who work for you, the first responders, have enough information before they go into a location where the negatives are being kept or the positives, that their safety is being,
We have operated with the abundance of conscious recognizing how serious this disease is. Through our emergency services, they have maintained and kept, our entire workforce apprised of how this disease can be disseminated. And as a government, our role is, as I stated before, to make sure that our citizens are provided updated information that comes directly from our health department and the CDC.
and generally speaking, are most of the people here in Charles County complying with the stay-at-home orders and only going to, supermarkets and pharmacies, essential businesses when needed?
And I think that is one of the things that makes our community unique. When the directive was put in place that began on this past Wednesday, the response from our community was one that recognized that this is for the good of our community, and by acknowledging and responding directly to these directives, we will mitigate as much as we possibly can the spread of the disease. So yes, absolutely. Thank you.
We do have a family member here that's willing to say something, John.
I'm John Willis, and I have a family member at Sage Point, been there for a number of years. I can only say this, they have been very transparent, keeping us apprised of how things are going. We were notified immediately upon testing, and once they got the test results, they notified us. So, been going there for a number of years. I don't know how these guys are doing this on a daily basis. It's just incredible the work they're doing, and they're taking really good care of my family member.
How stressful is it for you, sir, that you can't see the person you love at this time?
Incredibly stressful, but I understand what is going on, and Sage Point's kept me updated. I mean, weekly Skype sessions, calls all the time. We don't have any complaints about that whatsoever. Don't have any complaints about anything. They've done an incredible job.
I mean, I can't speak specifically to why the numbers are not available, but it is my understanding, and this is coming directly from Dr. Haft and the state, that they are in the process of making that information comprehensively available to the entire public. I think just listening to his comments today, my sense is they're trying to get an accurate count that can be directly provided to the public.
But there was, in Maryland, there was this nursing facility in Mount Airy, and everybody knew every other day their numbers. Ms. Riggs, you can't just kind of share with the community. We know places all over. I've got a family member on Long Island, and 9 people have died in that specific facility. Can you share with us, like, just at your place, how many are positive and how many sadly have passed?
So I guess.
Whatever you have to answer.
Again, I think we've all said the same thing. We, as an organization, report up to the Maryland Department of Health. That's who we get our license from as a nursing facility, and that's whose guidance we have to follow. And it's the local Department of Health and the Maryland Department of Health, and we are following their direction in terms of how they own that information, and it is up to them to report that in a responsible way, and that's how we're following their guidance. Just like we're following their guidance on infection control processes and on testing and all of that, we follow their guidance. And so the Maryland Department of Health has said that they're working on putting that information together in the way that they see fit, and that's why we can't.
And we had someone, apparently a staff person, saying that they had been home isolating and then were encouraged, even with a doctor note, we need you back in here. I know it's all hands on deck. Can you address that? Is there pressure being put on your frontline people to get back perhaps sooner than they should?
We were able to get access to rapid testing. And so in some cases, the testing was taking very long. We having a worker go out, get the test, it was taking very long to get them back. Working with our community partners, we were able to access rapid testing, which we made available to those employees that were out so that we could quickly determine were they positive, were they negative, and if they were negative, to be able to bring them back. So this was not asking them to come back without assuring that they were not they were positive, assuring that they were negative and could come back into the environment. We just had access to new testing equipment that we made available just this week to employees. So,
I had Dr. Hatt. Overwhelmed and understaffed, is that how you would describe?
no, I wouldn't. I would say, again, as Dr. Haff said, we meet the requirements we are required again through the Maryland Department of Health for staffing ratios, and we're meeting that. Overwhelmed, I would bet you all the people behind me are probably shaking their head. This is hard for the entire community, and it's especially hard for those of us that work with the very vulnerable population that we deal with. And SagePoint has a 50-year reputation in this community, and we're a nonprofit organization. We're community partners with everyone. We've worked all the way along, and they have helped us. They've shored up our staff and helped us when we needed it. But overwhelmed, I would say, I would agree with Dr. Haft, it is overwhelming. But we're managing.
All right. Thank you for coming. Thank you for coming and covering our statement today. We appreciate it. I know I need to take my mask off. That's all for today. And if you have any further questions, Jennifer Harris, Chief of Media Services, Charles County Government, please direct them my way and we'll make sure they get answered. Thank you, sir.